very much. Yes, malaria is a parasitic infection. It's an infection. It's a parasitic infection caused by a parasite that we call malaria. The parasite we call Plasmodium. So malaria being a blood-borne infection, it has symptoms. Usually these symptoms come as well because the Plasmodium is in your blood. And these Plasmodium have around 5 types of different malaria in different areas depending on the heights and the regions. Like here in the tropics, a different type of malaria that is rampant. So when you get this infection in your blood, this Plasmodium species of the parasite goes direct to your liver. It infects your liver. After a certain period of time, it matures from there and it pours into your blood. So the moment it pours into your blood, it starts to distort your red blood cells. It starts to make your blood thick. It starts to stimulate your body to release so many chemicals that will raise your temperature. So because of it being in blood, it comes with a consortium of symptoms. For example, high-grade fevers, because it's in your blood. It comes with features of severe headache because of the reduced supply of this blood to the brain. You get severe headache because of its concentration in the blood. It reduces blood supply to the joints, so you get joint pains, you get general body weakness, you get chills, you feel cold, so you get too tired. You get and variation. You can get high fevers like in the morning. Then during the day you feel so cold, then later in the evening you get high fever. So it's diurnal. So basically, malaria, it is a parasitic infection, blood-borne. And how do we get it? We get infected from an infected mosquito. So these malaria parasites are always in the saliva of the mosquito, especially the female mosquitoes. So when they come to pick blood, to pick iron from a human being to breed their eggs, they infect you, and that's how we get it. Yeah, so it's a female anopheles mosquito that comes to pick iron from you, and then it infects you with malaria. It infects you with that Plasmodium, especially the parasite, as it's trying to pick blood. So that's when the whole process starts. It goes to your liver, from liver to your blood, and then you get all the symptoms. Yes, so that's malaria.
Thank you.
It's symptoms. Yeah.
Doctor, what are the difference between uncomplicated malaria and severe malaria? Complicated.
Yes, thank you so much for that question. So we have several complications. The only thing that makes it uncomplicated is without presence of those complications. When the complications are there, then we say it's complicated. And also the amount of malaria that you have in a blood sample matters. For example, if I take off a blood sample and I do a blood film, a slide, and I find you have almost more than 20 malaria parasites per film, that one is considered as a complicated malaria because you're having too much malaria parasites. Anytime complications are going to ensue. But if you have less than those 20 malaria parasites in a certain film when you're in the lab, less than 20, and you have no any other feature for any complicated, that's when we call it uncomplicated malaria. So besides the number of the parasites you have, which features we look at? For example, if someone comes in with a conversion, that one we call it severe malaria with conversion, the same as complicated malaria with a conversion. That means this malaria started distorting their brain activity. If someone comes in with, let me say, black water fever, they come in with tea-colored urine, Coca-Cola urine appearance, that means these kidneys have been affected by malaria. So we call it complicated malaria, or what we call algae malaria, or what we call acute kidney injury in malaria. Others can come with high-grade fevers, 39 degrees centigrade. That one we call severe malaria with hyperpyrexia. Pyrexia is raised body temperature, but when it's more than 39, then it becomes very high temperature. So we call it severe malaria with hyperpyrexia. There are those ones who come in with severe malaria with an acute liver injury. They are jaundiced. They have a right upper quadrant tenderness. Their right part of the abdomen is very tender. Why? Because the malaria cells have distorted the architecture of their liver, and then their liver is starting to die away. So when we go into the lab, we do the liver function tests. We find their enzymes are way too high. So that's a complication of malaria. Others can come in with complications of malaria. For example, there is what we call a spleen. This spleen usually is supposed to protect you, produce your antibodies, very important in your immune system. So sometimes malaria can attack it. And when it attacks it, it can become swollen and big, what we call splenomegaly. So it can actually react what we call hypermalarial syndrome, hypersplenic hypermalarial syndrome, HHS. Yeah. So what happens is that this spleen starts to pull even the normal blood, because its role is to protect you, pull the dead blood cells. But when it becomes hypersplenic, it becomes very big and then hyperactive. It does what it's supposed to do, but at a higher rate. It starts to pull blood from you. It becomes big, so you start getting severe anemia because of hypersplenicity. Very big, very tender. So that's also a complication of malaria. And also anemia. Anemia is low blood. We look at your hemoglobin. If it's less than 11.5 for a female, less than 12.5 for a male, we say you have low blood, because the parasites can enter your red blood cells and they rupture them. So when they rupture them, you keep losing blood. Your HB drops. So we call it severe malaria with severe anemia. So that's also a complication. So those are the things that we look at and we say, oh, this is malaria with complications. And malaria actually kills even up to today. Children in Uganda still dying of malaria.
Yes, especially dangerous for children and pregnant women.
Pregnant women. So, and for the case with pregnant women, it's a little bit different, because malaria in pregnancy, every malaria was carried as severe because of the baby and the immune system of the mothers. So when you're pregnant, there's what we call the umbilical cord, that cord that feeds your baby. It has some receptors where malaria parasites like a lot. So even if you had only simple malaria, it will just cross and goes to the placenta. And when it goes actually to the cord and the placenta. So when it goes there, it obliterates the placenta. So there is reduced supply of nutrients, oxygen to the baby. And that's why we get a lot of miscarriages in the first trimester because of malaria. We got intrauterine fetal death because of malaria. And you can also have congenital complications of malaria to the baby.
Like it was in my case.
Yes. Severe cases. So that's the difference between uncomplicated and complicated malaria.
Thank you, Doctor.
You're welcome.
What are the costs of full treatment for one child, especially with severe malaria?
Severe malaria. So ideally, the cost is variable, and the burden of the disease to the nation is still high, because the drugs that are supposed to treat severe malaria are not readily available. What sometimes the government can provide, now I'm talking about the public service, public hospitals. Those drugs, the government has tried a lot to bring those drugs, but still they're inadequate. Because I mean, some of those facilities, we go there and you have few doses, depending on the numbers of the patients that come in with severe malaria. Because the severe malaria is not managed like uncomplicated malaria. When severe, we start with intravenous treatment. Attesmate is the commonest drug and safest line of management because of its bioavailability and everything, and its sensitivity to the plasmodium species. But that drug is costly, and the government cannot provide that drug to the whole population in this country. So it's quite challenging, and that's why we're still having children dying of what? Of malaria.
Do we know the rates? How many children dying every month for malaria or yearly?
Right now I don't know the current statistics, but previously, about 2 years ago, we had almost 800 children dying per day of malaria. 800.
That's a huge number.
That's a huge number. 800. That's like 3 years ago. 800 children were dying of malaria per day. That was actually a big number. Yes, they were dying of malaria per day. So the cost of treating malaria is a bit heavy, but we can't give in terms of shillings. We cannot. Then sometimes you can have severe malaria that is resistant to the first line management of what? Of complicated malaria, and you have to switch another drug. That drug and is also not ready. Yes.
Thank you so much, Doctor.
So that's why private practice is a little bit better, because if you have money, you can access everything that you want.
Yes.
So most of the deaths that we get are always in the rural areas. The distance from your home to the hospital quite long. So by the time that sometimes even the people in the villages, they still have myths about malaria. They find not until someone gets jaundice, starts vomiting yellow, that's when they would wish to go to the hospital. When a child gets a fever, they get herbal medicine and give. They keep doing what we call tepid sponging, get a warm cloth, try to reduce the temperature, give their herbal medicine. By the time they know this is severe malaria, probably when the child has convulsed. So we still have such gaps, knowledge gaps in the rural areas. We ain't giving them. They're not so much well informed about this malaria. However much everywhere on the TVs and everywhere they're talking about malaria, but there is that portion of people that don't have a TV. There are those portion of people who still believe that malaria can be treated by herbal medicine. And the most important factor, it is poverty.
Yes.
But you can find a family that cannot even transfer the child from here to the nearest health center.
So the most important is education.
Education.
Time.
Yes.
Fight with the time here.
And also having, if the government can increase on securing such medicines and make them available, and also instead like putting more health facilities that can manage even severe malaria. Because when you look at some of the facilities that are in the villages, they may only have drugs for uncomplicated malaria. Yeah. So these intravenous drugs, they are somehow not reached to each and every nearby facility today. So if the government can modify these facilities, try to put those drugs that can help manage severe malaria instead of referring, because there's a referral system. You find someone who's in a health center too, they're not able to manage severe malaria, and it's an immediate center to the village. So you find them referring, and the mother takes like 3 days to go to the referral point. Yes. So that's the period when those people lose their things. Yeah.
Thank you, Dr. Gilbert, for your knowledge, for giving us all those information.
Yes,
and we're gonna fight together malaria.
Yeah.
Thank you so much.
Thank you. Yeah.
Okay.